Nueva Vida es una comunidad que está un poco alejada del centro de Ciudad Sandino y aún más alejado de lo que es Managua. Y ellos no tienen atención fuera de este lugar. Entonces nos empeñamos un poco más en esta comunidad porque hay un poco más de necesidad en cuanto a salud. Aquí en esta comunidad no hay aguas negras, hay botaderos de basura ilegal de todo el barrio. Entonces esto viene a perjudicar mucho la salud y por eso hay mucha gente, muchos niños enfermos, sobre todo los niños.
We've had pretty much 3 or sometimes 4 stations. One of them was in the pharmacy where we're taking the prescriptions that we get from the providers and we give the directions to the patients on how to take their pills, when to take them, if they need to take it with water, all the information that any doctor would give you before giving medication. And then we work in the intake station where we would call the patient's name out into the waiting room and bring them in and do their vitals, get their information, like their home address, their health history, things like that. And we'd sort of organize them into which doctors or NP students going to see them, like the pediatrician or the women's health doctor or the general medicine doctor.
We see patients every morning. I've been seeing all the pediatric patients. Boom, 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 así. They range in what their reason for a visit is. A lot of acute care visits for the most part, but a lot of these patients also aren't having their regular well visits. A kid is a kid anywhere. They're happy, they're playful, they just want to kind of enjoy being in the same space as you. But at the same time, these are kids that have so many problems and they waited 4 to 5 hours to have a visit with me, and it's been really tough internally to kind of grapple with the fact that you can only do so much no matter where you are.
I've had the opportunity to really enter into the lives of these patients and see that sort of manifest in the conditions they may be presenting with. Y cuando empezó el dolor. And sort of see the effects of sort of their culture and their access to healthcare or lack thereof, and figuring out how to best serve these individuals.
Back in the States, we get very caught up when we're in the clinical sites in the hospitals, we're taking care of the patient. You don't have a sense of where they're going, nor where they've come from. And so one of the goals for this trip is to really expose the students, and I think that's the importance of not only working in the clinic that's within their community, but also of doing the home visits. Really challenges them to think a little more about the before and after, not just the hospital.
Today we saw about 6-7 patients and we took their vitals, their blood pressure, we took their sugar, and it was a very humbling experience as well to be able to go into someone's home and be so open and so invited in despite of the little that they have. The community health partners, they knew the community, they know the people, the people were comfortable enough to talk to them, tell them what was going on, what they needed to work on, and they're just very empowering people.
Bueno, es que uno como habitante y como promotor de la comunidad ya conoce la necesidad y lo que necesita la gente, de qué padecen, qué es lo que necesitan de salud y de qué manera se les puede ayudar para que vengan a pasar consulta.
As nurses, we are a part of a very complex system, and it's a lot about disease rather than the individual with the disease. And so because of this experience, I've learned the power of empowering people and allowing them to make changes in their own health rather than us coming into their lives and kind of wanting to fix them. But there's a lot of power in kind of using the skills and the strengths that people already have.
Nurses are really primed to be advocates for the patient. I mean, we get to talk to patients on a daily basis and hear their story and see exactly how this is manifesting in their bodies. But I really do feel like we're called to do more than that.
I think we see the opportunity for something better, and just that we can hold on to those high moments that we've had here in Nicaragua, but also the times when we felt low or very challenged in a very good way, that we can hold on to those to sort of improve our own practice as nurses and ourselves as human beings.
This has been the reason I got into nursing. Coming here has been the reason I got into nursing. Any nursing program could teach you how to treat people, but BC teaches you how to treat people with love, and that's really special. And you can be in the center of Boston or the center of Nicaragua, and I understand when people are being kind and genuine, and that's amazing, and I feel like that's gotten me really far on this trip.
¿Por qué usted sigue haciendo lo que está haciendo aquí en Nicaragua?
Bueno, yo siempre lo he hecho por, así como dice el dicho, por amor a la comunidad, por amor a mi familia, a mis hijos, al medio ambiente y por amor a la salud, sobre todo por amor a Dios, porque dice la palabra de Dios, amar a los otros como a ti mismo. Si miro que necesitan algo, pues yo de una manera u otra busco la manera de ayudarles, porque eso me pone satisfactoriamente como humano que somos.